Now. Folks, the size of Americans has drastically increased over the last 40 years. If you look at the impact of sugar, how our lifestyles have changed, also when you talk about in terms of servings as well, again, Americans have gotten larger. It has impacted us in a dramatic way. There are more Americans who are on various drugs in order to lose weight. You've got the crash diets, the fads, all those different things along those lines. You even have had generals in the United States military talk about how obesity has become a national security concern because a number of young folks simply could not qualify to even get in the military because of their weight. It has an economic impact as well. Folks are dying, getting much younger, getting diseases as well. And so what can we do? What should African Americans be doing to confront the reality of obesity even in our community? For the next hour, we're going to talk about this here. We've got a number of experts to talk about this here. Joining me right now is Dr. Yolanda Hancock, a double board certified pediatrician, obesity medicine specialist, also public health expert, Dr. Tiffany Bell Washington, a quadruple board certified physician specializing in obesity, lifestyle medicine, psychiatry, and public health. Will be Michelle Tedder, founder and CEO of Village Empowerment Solutions and senior program manager for Black Women's Health Imperative, joins us as well. And also Nelson Dunlap, the Vice President for Public Policy and External Affairs in the Global Health Equity Institute at Meharry Medical College. Now, I want to start this way, and let's see here who I want to go to first. And so, Yolanda, I'll go to you. So we talk about obesity. First of all, let's deal with the most base level. Exactly what is it?
So obesity, we define it based on body mass index. A lot of people really question whether or not we should use it as a tool, but right now that's the only thing that we have. It's really comparing weight and height. With a BMI of 25 to 29, that is the definition of overweight. With a BMI of 30 or greater, that's the definition of obesity. And thankfully, over the past 10 years, we've now defined obesity as a medical condition. Initially, we thought of it as a behavioral condition, but we finally have a diagnostic code. We approach it as a clinical issue. There are interventions that we can utilize in order to affect change in people's lives so that we can better manage obesity as a clinical issue as opposed to a behavioral one.
That's something that's, I think, different there, because when we talk about this, for the longest, folks always kept going, oh, wait, focus on weight as opposed to focusing on the mental aspect of obesity.
That's correct. And there is definitely a correlation between your mental health and your obesity or your weight. A lot of bias is given in terms of both of those issues. So with depression, mental health, and also with obesity, there tends to be a lot of biases that prevent our people, especially from seeking help, seeking treatment, and being willing to get the help when we are informing them that this is, in fact, a disease.
When we talk about, of course, obesity here, it leads to what? Various issues: hypertension, cardiovascular disease, and different, of course, diabetes. 11.3% of the United States living with diabetes, about 37.3 million Americans. But you have a significant higher incident of African Americans with diabetes. Why?
Why is that? That is a very important question. You know, it's difficult to say, especially, but we live in situations where a lot of our people are unfortunately in areas where there are not access to grocery stores, safe neighborhoods where we can exercise. They don't have insurance coverage to help them get preventative care. So if I realize I'm having problems with my blood sugar or diabetes, or I'm, sweating more, having, using the bathroom more frequently, feeling thirstier, but I don't have access to a primary care doctor or insurance, or my insurance does not cover those things, then you find yourself in a place where you're not really seeking care or going to the doctor until you are at very advanced stages of disease. And later, I'm sure we'll talk about it, but that's when a lot of these medications come into place where we're really needing them. And it would be better for a lot of our African-American populations and people to seek help in the forefront on more of the preventative side, more so than after the fact when you have diabetes and very high issues with needing insulin and also other medications.
Michelle, we're going to further unpack that, but I do want to go back to the mental aspect in terms of what drives it. Obviously, not just what we eat, but also our mental state, our surroundings, how we grew up. I mean, all these different things, but also the type of activities that we do as well. Movement, all of these things actually matter.
Absolutely. It takes a multi-factorial approach to deal with obesity. I living witness and example of how you need to have access to all of the things in order to address living with obesity. And what I mean by that is that I am somebody who had weight loss surgery in 2017, have lost and kept off about 80 pounds, but that was just the beginning. That is not the end all to dealing with obesity. I happen to, have access to medications, to the lifestyle change programs, all of the things that it takes to maintain your health and maintain your weight when you're living with the disease of obesity.
Nelson, again, we talk about this subject. There's so many pieces to it. Yes, you have the fitness piece, the diet piece, you have the medical piece in terms of the drugs, you have the mental piece, but you got to have the public policy piece as well. And so I want to touch on that one because we're going to pick up that after the break a little bit more. But public policy drives so much of this because of the resources in terms of that can be given, but also how government impacts it. We talked earlier about, again, having a major drug manufacturer announce the capping of the prices of insulin. Okay, look, when you're dealing with this, those who are in diabetes, if you're now capping it at $35 out-of-pocket cost, that impacts folks economically because you have people who are choosing between their drugs and what they eat. And so this is one of those topics that is so multifaceted that all too often in this country we've only dealt with it in a one-dimensional way.
Yeah, you're definitely correct, Roland. And I think that what you're talking about is really those political determinants of health. We're talking about those upstream instigators, right? We've mentioned the social determinants of health so far. We talk about the places where people live, play, pray, work, and the impact they have on our lives, the impact they have on our health outcomes, the impact they have on obesity rates. And what I'm saying is sometimes we have to move further upstream. We have to talk about those decisions, be them legislative, legal, administrative, policy, as you say, those decisions that were made that have these downstream effects, right? So we talk about access, we talk about the decisions to place, education institutions where they are, to place fresh food where it is. All of these political and social determinants of health interact with one another to really drive this obesity pandemic and epidemic that we're dealing with. So you are spot on.
We're going to go to a break in a second, and we come back. I want to deal in the next segment specifically on the public policy front from a federal, state, and local level as well, in terms of how we should be attacking the issue of obesity, what our audience should be saying and doing when they're talking to their lawmakers about the role that they can play when it comes to confronting what has really truly become a crisis in America. You're watching this special on obesity right here on the Black Star Network. Folks, don't forget, download our app, Apple phone, Android phone, Apple TV, Android TV, Roku, Amazon Fire TV, Xbox One, and Samsung Smart TV. You're watching Roland Martin Unfiltered on the Black Star Network. Black Star Network is here.
Oh, no punch!
I'm real revolutionary right now.
Thank you for being the voice of Black America.
All momentum we have now, we have to keep this going.
The video looks phenomenal.
See, there's a difference between Black Star Network and Black-owned media and something like CNN.
You can't be Black-owned media and be scared.
It's time to be smart.
Bring your eyeballs home.
You dig?
Hatred on the streets, a horrific scene, a white nationalist rally that descended into deadly violence.
White people are losing their damn minds.
As an angry pro-Trump mob storms the U.S. Capitol, we've seen shots.
We're about to see the rise of what I call white minority resistance. We have seen white folks in this country who simply cannot tolerate black folks voting.
I think what we're seeing is the inevitable result of violent denial.
This is part of American history. Every time that people of color have made progress, whether real or symbolic, there has been what Carol Anderson at Emory University calls white rage as a backlash.
This is the rise of the Proud Boys and the Boogaloo Boys. America, there's going to be more of this.
Here's all the Proud Boys, guys.
This country is getting increasingly racist in its behaviors and its attitudes because of the fear of white people.
The fear that they're taking our jobs, they're taking our resources, they're taking our women. This is white fear.
I'm Shantae Moore.
Hi, I'm BB Winans.
Hey, I'm Donnie Simpson.
What's up? I'm Lance Gross, and you're watching Roland Martin Unfiltered.
All right, welcome back to this Black Star Network special on the issue of obesity. Nelson, I want to start with you. And so in terms of from your perspective, what are you seeing public policy-wise as to how lawmakers are dealing with this issue? Are they properly dealing with it? Are they misclassifying it? Do we have enough resources that are going to the topic? Just share with us and give people an overview from a public policy standpoint how obesity is being dealt with by federal lawmakers.
Yes, and I think you're spot on with the beginning statement when you talked about the fact that this is a public policy argument, it's a public policy concern, and honestly a national security issue as well. When we talk about the fact that X number of our young folks won't even qualify for military service because of their weight. And so I say all that to say is that there's definitely more that can be done on the federal, state, and local level. And just like I mentioned earlier, that gets back to those political determinants of health. There is an opportunity for our federal government to really kind of do one of two things, or two things, honestly. It's to address these political and social determinants of health, and then to address the issues with insurance coverage, which I'm sure we will talk about later. But there's any number of metabolic options out there that can really help with obesity as a disease. And there's coverage gaps, there's coverage holes, there's opportunities to expand that coverage to make sure that we have the care that we need. But it all starts with us raising the alarm, speaking to these concerns, and making sure that our policymakers are representative of the concerns of the issues that are plaguing our community.
Yolanda, do you believe lawmakers get it and understand how significant of an issue this is?
Unfortunately, I don't. I believe that a lot of times we see obesity as a behavioral issue, even though it's now classified as a medical diagnosis. I had a colleague actually say that obesity was a hand-to-mouth disease, as if it was simply what people ate and the lack of physical activity. And in my experience, both as an obesity medicine expert and in working in public health, we know that it is the social determinants that drive how I make choice. We're here in the District of Columbia. It's divided by 8 wards. In Ward 3, it's affluent, predominantly white. In Ward 7 and 8, predominantly African-American and under-resourced. In Ward 3, there are 16 grocery stores. Between Ward 7 and 8 combined, there are 3. That's 1 grocery store for every 8,000 people in Ward 3, one grocery store for every 85,000 individuals in Ward 7 and 8. And that's not by accident. It is policy-driven food apartheid. And when people recognize how important policy is, that there is health in every single policy that's passed, and that there's potential for an obesogenic environment to be developed based on policy, once that's recognized, that's when policy will change. Unfortunately, for most elected officials and the population in general, they see obesity as a choice, that people dealing with obesity is simply because they eat too much. And most of my patients, it's not an issue of eating too much. If anything, they eat less than we would assume that they do. But it's based on the environment in which they're making food choices. It's even here in Prince George's County where I live, 75% of our food establishments are fast food. And you're talking about a very affluent community. Again, based on zoning decisions. And so we see the impact of policy each and every day when it comes to the development or protection against obesity. Once lawmakers realize that there are a multitude of factors that influence food choice, physical activity, mental health, to your point, all of those influence whether or not I gain weight in combination with genetics and personal choice. Once we recognize that and we remove the stigma that's historically been associated with obesity, that's when policy will change.
Tiffany, I remember when Michelle Obama's Healthy, Hunger-Free Kids Act was going through, even when it was passed, you had all of these folks on the right who were whining, complaining, oh, this is the mommy state. I mean, they were literally trying to deal with obesity, but also hungry kids. And I'm just trying to figure out, when the hell did healthy eating as well as fighting obesity become a political left, right, blue, red thing?
Right. That's a very interesting point that you make. And unfortunately, I would say that it absolutely should not be, right? We all should have access, as has been mentioned, to healthy foods that are affordable and that we can get easily and make, in our life. I am not sure exactly why it became political, but it did. And it affects us with the food choices that we make, with the access to healthcare, all of that. But it also affects when we actually have treatments for these diseases. So we have medications that can treat obesity. But if you can't afford that medicine, we have no way to really get it to you and to help you prevent cancers and diabetes and high blood pressure and all the things that end our lives very early. And so one thing I'd like to say is commercial insurances tend to follow what Medicare does. For some reason, Medicare is not covering these anti-obesity medications. Many years ago, they thought, okay, obesity was a cosmetic problem. You don't look good. You have too much fat on your body. That's the problem. The problem is not that. It's beyond that. It's a health issue. So it really does need to be covered. And if Medicare covers it, usually other people follow. So I think that would give our people better access as well.
Well, Michelle, again, when I look at this, where you constantly have this battle, if you look at obesity numbers, aren't they worse in red states?
They are, and I think that that's very telling, and that's a great point that you bring up, because it goes back to not the political determinants of health, but let's just be honest, it's about the structural racism that exists in our country. And so I say that because when you don't have access to these things and you look at the policies that prevent people from having those things and who's more greatly impacted, then we have our answer. So we have a lot of work to do around, one, I think empowering the public to understand the connection between their voice politically and putting pressure on the systems and powers that continue to oppress in this way. And I think that with that and educating people on how to be advocates, not only for themselves, but for their communities at large, then I think we can move the needle a little faster.
What about, for any of you, anyone could chime in, are we seeing on the state level or the county or the city level this being addressed in a positive manner? Who out there is actually, you believe, who's doing a good job trying to deal with this issue for their residents?
I'll jump in. I serve as the health consultant for the county council here in Prince George's County when they sit as the Board of Health. And in 2020, we passed the Prince George's County Healthy Kids Meal Bill. And what that did was compelled the 75% of the fast food establishments in Prince George's County to offer a healthy option for parents when we take our children out to eat. prior to the passage of this legislation, it was hard to find any healthy options. I'm a mom, that's my most important job. And on occasion, when I took my daughter out to eat, it was frustrating not being able to find a healthy option. The fact that we were the first in the country to pass comprehensive legislation that didn't just cover soda, didn't just cover sides, but the entire meal. We've set the tone for the state of Maryland and hopefully for the country.
Anyone else?
Yeah, I will say that, to the point that Dr. Williamson made earlier, the federal government is leading the way on this, right? They're supposed to be leading the way on this. And if Medicare could get it right, Medicare could, expand coverage to cover these anti-obesity medications. A lot of other states would follow suit. Right now, I believe it's 25 states that already include anti-obesity medications in their state health plans. So, the federal government's doing that. Our senators, our representatives, even those on the Hill will have access to this in their health plans. But the constituents that they represent, they might not. Some of our states, their health plans offer it, but some of their constituents won't. So again, we're seeing at the top level, it's just not trickling down to the point where everyone will be able to have access to it in an equitable manner. So there is opportunities. There are examples in both red and blue states. It's just a matter of us raising our voices and making sure that all of our communities have access to it.
All right, my other two guests.
Well, this fall, I had the opportunity to attend the White House Conference on Hunger, Health, and Nutrition, and that was the first time they had done that for many, many, many years. But and while I feel like obesity could have been highlighted a little bit more than it was, out of that gathering, it did highlight some of these things we're talking about from a political standpoint. And I believe from the report that there are things that are going to come down the pike to help to address some of these things at the state level as well.
The thing that, I think one of the things you also are seeing, you're seeing city leaders, mayors also lead on this when it comes to them encouraging healthy living. Again, anyone else can jump in, but I got about a couple of minutes left in this break. What about school boards? Are we seeing any school boards who are saying, hey, we're not going to wait on the federal folks or the state or the city. We're going to be far more proactive when it comes to our students, when it comes to the issue of obesity?
I'll jump in again. Here in the District of Columbia back in 2009, the DC City Council actually passed the DC Healthy Schools Act, and it addressed a variety of issues that link back to pediatric obesity. It included addressing food insecurity by providing breakfast in the classroom for all students. It really evaluated how healthy school lunches were and used student influence in order to determine how to sort of flip the script on the school lunch to make it healthier. They required physical activity measures to be met. So it was very comprehensive in how they approached it, and they're continuing to show metrics demonstrating how much better children are eating in terms of increasing their fruit and vegetable intake, how much more they're engaging in physical activity, and it really set the tone and set an example for the rest of the country in how the school system, especially where children spend the majority of their time during the week, can truly affect change in how we're tackling this epidemic, particularly in the pediatric population.
All right, folks, got to go to break. We come back. Let's talk medicine dealing with the obesity issue in America. Should kids be put on pills or taking medicine to deal with obesity? Well, that's been a hot topic of the last few weeks. We'll ask our panel about that as well. You're watching a special edition of Roland Martin Unfiltered on the Black Star Network on obesity in Black America. Back in a moment.
A lot of these corporations or people that are running stuff push black people if they're doing a certain thing. What that does is it creates a butterfly effect of any young kid who, wants to leave any situation they're in, and the only people they see are people that are doing this. So I gotta be a gangster, I gotta shoot, I gotta sell, I gotta do this in order to do it. And it just becomes a cycle. But when someone comes around and is making we don't do, they don't want to push it or put money into it. So that's definitely something I'm trying to fix too, is just show there's other avenues. You don't gotta be a rapper, you don't gotta be a ball player. You can be a country singer, you can be an opera singer, you can be a damn whatever, showing the different avenues. And that is possible, and it's hard for people to realize it's possible until someone does.
Next on The Black Table with me, Greg Carr, we featured the brand new work of Professor Angie Porter, which, simply put, is a revolutionary reframing of the African experience in this country. It's the one legal article everyone, and I mean everyone, should read. Professor Porter and Dr. Valencia Watkins, our legal roundtable team, join us to explore the paper that I guarantee is going to prompt a major aha moment in our culture.
You crystallize it by saying, who are we to other people? Who are African people to others? Governance is our thing. Who are we to each other? The structures we create for ourselves, how we order the universe as African people.
That's next on The Black Table, here on the Black Star Network.
Hi, I'm Vivian Green.
Hey everybody, this is your man Fred Hammond, and you're watching Roland Martin, my man, Unfiltered.
All right, folks, let's talk about drugs and obesity. There are a number of new drugs out that have played a huge role in helping people deal with obesity, okay? Of course, you had the different surgeries as well. But one of the stories that I saw a couple of months ago caught my attention, dealt with the issue of childhood obesity and medication. And that is new guidelines were issued by the American Academy of Pediatrics, where they encourage young folks who are dealing with obesity to be medicated. Now, that caused a lot of other people to say, hey, man, what's going on? Why are we doing with this? I've had some fitness experts, some other dietitians who were on who said, no, that's the last thing that we should have happen. Michelle, again, these are doctors, who pediatricians, who say we can't wait. 14.4 million young people in this country have obesity. They say it's causing too many problems like high blood pressure, diabetes, and depression. Medication should be the route. What do you say?
So I think that we have to keep an open mind about treating the disease of obesity, just like we look at other chronic diseases. We have to realize that obesity is a chronic disease, and it does start very young. I can tell you again, I can use myself as an example. I've struggled with weight my entire life. I do understand the mixed feelings about it and the hesitancy, but I think that under supervision and with educating parents as well as the clients, that it is something we need to look at as a viable option to help to prevent the long-term chronic issues that are associated with obesity.
Yolanda, where do you come in on this?
So as both a pediatrician and an obesity medicine expert, I'm in full support of utilizing medication as part of the treatment modality for obesity. The American Academy of Pediatrics, in their updated guidelines, this is the first time they've actually included obesity medications as part of their recommendations. When the initial guidance came out back in 2008, obesity medications were not included because there were none yet FDA approved. As it stands right now, there are 4 medications that are approved in the pediatric population. The first is metformin. And it's actually not FDA approved, but has been used over the past 10 years in terms of obesity management for children 12 and older. In terms of other obesity medications, phentermine is approved for children 16 and older. Orlistat is a medication that blocks fat absorption. It is approved for children, as is another medication called liraglutide. Now, for each of those medications, they may be approved by the FDA, but that does not necessarily mean that they're going to be covered by insurance. What the AAP listed out was a standardized way in which we approach obesity. The first being lifestyle management, where personal trainers and dietitians and nutritionists are in full support. we have to recognize that there are certain levels of obesity at which diet and exercise aren't going to be able to manage certain cases of obesity, and it requires treatment the same way we would for asthma, the same way we would for high blood pressure. And again, it goes back to that mindset that we believe that if we just eat less and exercise more, that will fix it. You can't fix physiology in certain aspects of managing obesity, and that's where both medication and surgery play a key role.
I want to bring in Dr. Cedrina Calder. She is a board-certified preventive medicine physician specializing in lifestyle medicine and obesity medicine. So, Cedrina, I'll ask you, when it comes to children, should we be putting them on medication to deal with obesity?
So I agree with what was already said. So you really have to consider medications as an option. Medications are a great tool when it comes to weight loss. And there are so many children that are currently affected with obesity in this country. And what we do know about obesity is that it leads to severe chronic diseases further down the line. So I think that it should definitely be considered. Of course, you can try lifestyle changes initially, but there are many situations where lifestyle changes alone will not do it. And you must consider medications as an option as well.
There are a lot of folks out there who have been focused on the new obesity drugs. Many folks have actually called these drugs a game changer. Because they've actually impacted people in a quite a unique way. But Tiffany, it's caused problems because now we have folks, Tiffany, who are not frankly obese, who are making a mad dash. I think I saw a story where there was a TikTok video and folks just all of a sudden went after the drugs. They cost a significant amount of money. But again, the problem is, how do we ensure that the drugs that work are getting to people who need it, as opposed to individuals who are looking to lose 5 pounds to have their goal weight for their swimsuits?
Right. That's an excellent point that you're making. And so what I would say is, if you have 5, maybe 10 pounds to lose, these medications may not be appropriate for you. There are criteria that the doctor should be using to rule out who is appropriate and who is not. And that's based on the risk factors that you have. If you already have diabetes, if you already have high blood pressure or some other obesity-related disease, and obviously you're at higher risk, and you would do well to have that medication. If you have 5 to 10 pounds to lose, if it's simply cosmetic and you want to lose a little bit to look better in a swimsuit or something, obviously that is not a good use of the medication. But I do want to caution people, because they will say that the medicine should only be used for diabetes and not for obesity, and that's just simply not true. Obesity is a disease. There are medications that can treat it, and we really should not further stigmatize or bias people with obesity by not providing medications that can work. So yes, we should prevent people from using it for cosmetic reasons, and really the doctor should kind of be the gateway keeper for that. And then the price also stops a lot of people from being able to afford it, unfortunately. So we really do need some political change there as well.
Speaking about that, Nelson, again, these new drugs have been called highly effective. Yet they're not covered by Medicare and most Medicaid programs. Drugs cost upwards of $1,500 for a month's supply. Are we seeing any potential changes on the horizon federally to be able to cover these drugs for individuals who may be facing chronic obesity or who have chronic illnesses like diabetes?
Yes, we are seeing some progress, and I think you put your finger on when you referred to it as a game changer, right? These drugs are, in fact, a game changer for any number of people. But does everyone get to play that game? Is this a game that's locked behind a garden wall? Is it the country club of effects, right? This is only a game changer if you're allowed to have access to it. And so it goes back to the cost burden, the access to a primary care physician. All of these determinants are blocking the way. And I always try to apply that equity lens. So when you ask that question, when we think about that, you're right. We have to look at what's happening, where the trends are, where the progress is being made on the federal level. And yes, OPM is sending out letters. They're sending out letters to the federal health plans, letting them know to consider these anti-obesity medications on Medicare and not on Medicare, but with the federal health plans. But we're not seeing that in Medicare. And when I think about that, we talked about the children, but I also think about my grandparents. I think about our aunts, our uncles, the older individuals who have paid into the system, who have dealt with this for for years and years for any number of the reasons that we've already talked about that now are relying on Medicare and they won't have access to it. So what is it a game changer for everyone? I can't say so. It's only a game changer for those who are already on the court.
So, so in terms of, again, from a drug standpoint, moving forward, going down this particular path, I'm curious in terms of, what is next? Because cost is cost. If you're talking about spending $1,300 a month and you're having to come out of pocket, I mean, look, you're talking about, $15,000 a year just on the medicine. If you don't have those sort of dollars, then you're creating a situation where you pretty much have, the haves and the have-nots. And as we know, typically when it comes to issue of obesity, those folks who are in the have-not category are the ones who are most impacted by this. And so you're there in Nashville, Sadrina. You're there in Tennessee. What do you think, again, folks who are watching should be advocating, pushing for when it comes to dealing with this very issue?
We should be pushing for insurance companies to be able to cover more of these medications, because what we're doing right now is creating more of a disparity right now. So we know that almost 50% of African Americans have or will have obesity, and that's a huge issue. So when we talk about not covering medications, a lot of those same individuals are the individuals that are not being covered. They're not getting access to the medications, and now we're causing even more issues when it comes to increased rates of chronic diseases. So we're really increasing the disparity. We're increasing the gap. So that is what is needed. We really need to push that change. Insurance companies have to cover more of these medications for the population.
Well, and that's one of the things, Michelle, that's always interesting to me, where if you're an insurance company, you should want to be in the preventative state as opposed to, once you get sick, once it gets bad, then we'll cover things. I'm going, isn't that actually costing you more money?
Absolutely. That is exactly the point. I think many of these discussions that I participate in, that is exactly the discussion. And that is the point, is that, if you are spending literally billions of dollars are spent in this country treating high blood pressure, heart disease, cancer, all of these things, when honestly, we could reduce the number of dollars that's being spent once people are having these illnesses if we would just treat the root cause. And I think that really it comes down to, Martin, we just have a lot of work to do in terms of really educating the public around what this is and what this isn't. Helping people to understand that obesity is a disease, because, we only started that narrative within the last, 5 to 7 years. It wasn't even declared a disease by the AMA until I think something like 2015, 2016. And so that in and of itself is problematic. So we are still battling at the legislative level. We're still battling at the state level. We're battling even people who live with the disease are still battling sometimes to accept that it is a disease and it's not because you have poor willpower or because you're lazy or because you're not, dieting enough or what have you. So I think that changing the narrative around how we see this disease is one of the main keys that we've got to get focused on. And then once we can get people to come on board with that, I think that it's a little easier to have the conversation to say, listen, this is a disease, and you would not deny somebody who comes into your office who has diabetes or, they have a blockage in their heart. You would not deny them care. So why would you do that with someone living with a chronic disease like obesity? But we've got to be able to put pressure on the public and the powers that be and all stakeholders to understand that that's what this is. And so that changes how we approach it, how we deal with it.
Treat the root cause. Boy, that's a novel concept. That's novel. All right, hold tight.
Just saying.
I understand. Hold tight 1 second. I got to go to break. When we come back, we'll talk about what next. And so for all of our specialists here, those who are watching, what do they recommend they do next if they are dealing with obesity, dealing with weight issues, dealing with any of this? Where do they start? What do they do? So that's what I want to hear from each one of our experts when we come back right here on the special edition of Roland Martin Unfiltered, focusing on obesity in Black America, right here on the Black Star Network. Back in a moment.
Pull up a chair, take your seat at the Black Table with me, Dr. Greg Carr, here on the Black Star Network. Every week, we'll take a deeper dive into the world we're living in. Join the conversation only on the Black Star Network.
On the next Get Wealthy with me, Deborah Owens, America's Wealth Coach, the wealth gap has literally not changed in over 50 years, according to the Federal Reserve. On the next Get Wealthy, I'm excited to chat with Jim Castleberry, CEO of Known Holdings. They have created a platform, an ecosystem to bring resources to Blacks and people of color so they can scale their business.
Even though we've had several examples of African Americans and other people of color being able to be successful, we still aren't seeing the mass level of us being lifted up.
That's right here on Get Wealthy, only on Black Star Network.
We're all impacted by the culture, whether we know it or not. From politics to music and entertainment, it's a huge part of our lives, and we're going to talk about it every day right here on The Culture with me, Faraji Muhammad, only on the Black Star Network.
Hi, I'm Teresa Griffin.
Hi, my name is LaToya Luckett, and you're watching Roland Martin Unfiltered.
All right, folks, welcome back to the special edition of Roland Martin Unfiltered, dealing with obesity in Black America, powered by Novo Nordisk. I certainly want to thank them for partnering with us on this. And so let's deal with the what's next. There's somebody who's watching and they say, okay, I agree with you. You're right. Let's do something about it. I have no idea what to do next. And so if we're talking about from an individual standpoint, in terms of an individual dealing with this issue themselves, what do they do? But also, I want our experts to talk about, from a public policy standpoint, what is it that they want people to do to begin to impact this issue? Is this an issue that voters should be demanding of politicians who are running for local office, state office, and national office to be addressing? We ask these questions when it comes to fentanyl, when it comes to opioids, when it comes to these issues. But how often are you watching a town hall where this issue comes up in that conversation? So, Yolanda, I want to begin with you. For either one, public policy-wise or for the individual, where do they start? Somebody is sitting, watching, or listening right now, and they say, I know I'm obese. I know my BMI is too high. I don't know where to begin.
The first thing I would say is recognize that you are not obese, you are dealing with obesity. The second is to look at all the factors that influence how your body processes, metabolizes, and deals with food. So it isn't simply just eating, it's where are you in terms of your stress. We know that cortisol increases, it triggers over 1,300 stress responses in the body, resulting in weight gain. You could eat one meal a day and still gain weight. So think about stress, sleep, all of the other components that add to the risk of obesity. From a policy standpoint, what I would say for every voter, I'm a mom, and that's my most important job, vote like your child's life depends on it. Where is health in every single policy that the person you're about to vote for is manifesting? If health does not show up in the decision every single time they get ready to either pin legislation or push it forward, then that's not the person that we should vote for.
So, Drina, the point Yolanda just made, and I've had this conversation with many of our fitness and diet expert dietitians as well, is that idea of sleep, how the role that it plays when it comes to lowering your rate, lowering your weight in terms of being able to get all that under control. And I've had folks who say sleep is, I've had some say sleep is more important than even what you put in your mouth. Now, that doesn't mean you go out there and sleep 10 hours and then you eat fast food all day, but they said sleep plays such a huge critical role in confronting obesity, and too many Americans are not sleeping enough.
Yes, Roland, you're so right. The average American does not get enough sleep. So, the requirement for adults is about 7 to 9 hours a night or a day. If sleep is 7 to 9. Most people are not getting that. That's just very difficult to get in our busy lives. But sleep does play a role in overall health. We find people that are chronically sleep deficient tend to be at a higher weight. Also, the less sleep you get, it literally changes your hormones. It changes your cortisol level, increases that. It can do things such as make you hungrier, so you may want to eat more food. So sleep is super important when it comes to weight loss. Unfortunately, the average person doesn't realize that, but I agree that if you are someone who know that you are dealing with excess weight, you do want to start off with looking at your lifestyle. Sleep is one big factor that you want to improve upon if you are trying to lose weight.
That issue there, Michelle, and so many others. And so, Michelle, for you talked about surgery, weight coming off. And so talk about the adjustments that you made, let's say before you even had the surgery, adjustments you made and adjustments you would recommend to someone who's watching right now who says, I don't even know where to begin.
Mm-hmm. Well, there's several things I have to tell you. I'm a nurse also. And so even being a nurse, I have to be honest and tell you that along my journey, it was a long time into my journey before I even embraced the idea that I was living with a disease called obesity. And there's a couple of important things. You asked some really great questions about what did I do, because I was somebody who was doing all of the things. Okay. I was, watching my diet. I was exercising. I was, whatever it was that somebody said I could do to try to lose the weight, I was doing it. Here's a key factor that really helped me. I had a healthcare provider who saw me. She saw me, and she was able to sit down with me and have a heart-to-heart conversation and tell me, listen, this is far bigger than you are. I'm watching.
Oh, I want to stop you right there. Okay. When you said she saw me, it wasn't that I scheduled a visit. It was that you had a healthcare provider who said, I'm going to talk to you anyway about the issue, and you were listening, because we know based upon the stats, too many African Americans, when they have white doctors, that doesn't happen. Was your healthcare provider Black?
She was not, but
it's rare.
It's very rare. Listen, Roland, I was very, very blessed, but she was Indian, but she was really in tune to me. And I'm sharing that because I think one of the big pieces that we've got to delve into and get dollars to put money into is really educating healthcare providers, right? Because if you trust your provider, you can have compassionate conversations with them and your healthcare provider. And I said that intentionally, that she saw me. She saw Michelle. And so she knew that I was doing all of the things. And she literally said, I'm begging you. We really need to look at this from a different angle. Would you please talk with my colleague who happens to be a bariatric surgeon, because I think that you are an excellent candidate because you are doing all of the things.
You were doing all of the right things, but those things were not working.
Exactly. That's exactly right. And I also want to bring out the point that if you are someone just like me who's living with obesity and you're doing all of the things, please know that even with surgery or the medications, you still will have to do the things. Obesity is best attacked when you look at it from a mind, body, spirit issue. So managing your stress, taking care of your body, eating well, feeding your body good things. Those things don't go away. It's not an either or situation. It's a and situation. But I would say that if you're going to your healthcare provider and they're not listening to you, you need to fire them. I will fire a healthcare provider. I have no shame in my game to do that. The reason is that you need someone who is going to get you and who's going to work with you in collaboration with you to come up with a comprehensive treatment plan to deal with this disease called obesity.
Tiffany?
Yes, I wanted to add two things. The first thing is that I think absolutely obesity is something that needs to be addressed. Sure, locally, we need to elect people who are voting with our best interests, who are choosing for us, health in all things. But this also needs to be addressed on a federal level. And if Medicare, Part D, Medicare, Medicaid actually address this and cover these medications, $66 billion over the next 10 years would be saved. So that would be an extraordinary amount of money that would save our economy, but also the lives that we're losing at early ages, especially in the Black community, which is something near and dear to my heart. So I think that is the first thing I would mention, that you need to write to your legislators, make sure you're choosing people who are in support of health care for all. But then the second thing is, Michelle hit the nail on the head. What I wrote down earlier was that you need a physician who cares about you, someone who takes obesity seriously, doesn't shame you, doesn't say that you are obese and you're doing it wrong and then you're scared to go to the doctor or scared to get on the scale. You need someone who cares about your best interests. And you're right that often that is a doctor who looks like you, who maybe understands what you're going through in life. Sometimes it's not, but often it is. And then lastly, I wanted to say, as a mom, I am a mother. And I know for Black women, oftentimes we are trying to do too much at one time. We have a lot of stress. We may not be able to make time for ourselves. So my advice to my patients often is get a journal, try to journal if you can, go for a walk outside in fresh air if you can. But mostly we have to let go of the superwoman, strong Black woman stereotype and feel free to rest, get your sleep, control your stress, and then make sure you have a very strong healthcare team. So that is my advice. So.
All right, Nelson, take us home.
I have to say that it sounds like the previous two speakers are basically just doing plugs for HBCU Medical School. So a quick shout out for that. But I will say that I've got two words, both for the personal and for the public policy. On the personal end, the single greatest thing I've ever done in my life was marry my wife, who's a nurse. And she has instilled upon me the importance of extending grace. So for anyone that is struggling with the disease of obesity, because this is in fact a disease, extend grace to yourself to understand that this is a disease. For those around those individuals struggling with that, extend grace to them and extend grace to the system to figure out what is going to work for you. Extend grace. On the public policy front, it's to take a yes and approach, right? Yes and what else? Yes, diet and exercise and metabolics. Yes, we are getting the federal health employee plans are having access to the anti-obesity medications, and Medicare needs it, and insurance coverage needs it. Yes, and until we get to where we need to be and everyone has their best opportunity to achieve their optimal level of health.
All right, let me thank Nelson Dunlap, Michelle Tedder, also Yolandra Hancock, Tiffany Bell Washington, as well as Dr. Sadrina Calder. I want to thank all of y'all for being guests. Let me thank Novo Nordisk as well for sponsoring this. Folks, this is not the only time we're going to be talking about this because it is an ongoing issue. We've been following the policy battles that have been going on in the nation's capital and also across the country as well. And so this will be something that we'll be focusing on Roland Martin Unfiltered on the Black Star Network, plus our other shows as well. This is one of the reasons why when we started off a Healthy You in 2023, having so many different experts on talking about the issue of what we eat, how we eat, and also getting us moving, getting us not just locked down, eating processed foods, eating more fruits and vegetables, but also moving our body, being more active, and yes, That's still hard, Sadrina, those 7 to 9 hours, getting more sleep as well. And so, again, Novo Nordisk, we appreciate them partnering with the Black Star Network on this special. Folks, that is it. We'll see you tomorrow right here on the Black Star Network. Holla! Black Star Network is here.
Hold no punches.
I'm real revolutionary right now.
Support this man, Black Media. He makes sure that our stories are told.
Thank you for being the voice of Black America, Roland.
Stay black. I love y'all.
All momentum we have now, we have to keep this going.
The video looks phenomenal.
See, this difference between Black Star Network and Black-owned media and something like CNN.
You can't be Black-owned media and be scared.
It's time to be smart.
Bring your eyeballs home.
You dig? Pull up a chair. Take your seat. The Black Tape with me, Dr. Greg Carr, here on the Black Star Network. Every week, we'll take a deeper dive into the world we're living in. Join the conversation only on the Black Star Network.
Hi, I'm Dr. Jackie Hood Martin, and I have a question for you. Ever feel as if your life is teetering and the weight and pressure of the world is consistently on your shoulders? Well, let me tell you, living a balanced life isn't easy. Join me each Tuesday on Black Star Network for A Balanced Life with Dr. Jackie.
We're all impacted by the culture, whether we know it or not. From politics to music and entertainment, it's a huge part of our lives, and we're going to talk about it every day right here on The Culture with me, Faraji Muhammad, only on the Black Star Network.
I'm Deborah Owens, America's Wealth Coach, and my new show, Get Wealthy, focuses on the things that your financial advisor and bank isn't telling you, but you absolutely need to know. So watch Get Wealthy on the Black Star Network.